Welcome back to Care Decoded, the show where we simplify the complex world of documentation, coding, quality, and clinical AI so healthcare organizations can work smarter, not harder. I'm your host, Sunil Nihalani, and I'm the CEO of Inferscience. This episode today is special. It's our team's first episode of the new year. And honestly, 2025 was not just another year. It was a stress test for healthcare. So we saw evolving and tougher CMS expectations, heightened audit scrutiny, risk adjustment turbulence, and AI, finally moving from hype to accountability. 2025 forced leaders to confront a tough but important question. Can technology truly help clinicians and plans, or is it just another layer of complexity? So today, instead of bringing in an external guest, we are turning the microphone inwards to reflect on what the last year really taught us, what we heard from clinicians and health plans, and what 2026 is going to demand. So joining me today is my colleague, Mark McKeown, who spends every day working with health plans, provider organizations, and development teams, ensuring our solutions are not only innovative, but practical and trusted in the real world. Great to have you here, Mark.
Thank you, Sunil, and it's great to be here. You know, this is a conversation that we've been having internally for several months, as well as continuing conversations with payers and providers for quite a while this year. So it's nice to finally be able to bring it to Care Decoded audience.
Thank you, Mark. Looking forward to it. So let's start big picture. So when you look back on 2025, not just for Inferscience, but for healthcare broadly, what stands out the most for you?
Wow. 2025 was certainly a challenging year, but it also proved something important to all of us, I believe. There has been a lot of discussion around artificial intelligence helping to solve some of the major industry issues that we have in healthcare. But the reality is that, number one, AI without workflow is just more noise. It's almost distracting. The other thing that we found out was that more data isn't necessarily helpful. Now, more actionable intelligence is, but just more data isn't. Over this past year, even as challenging as it was, a lot of organizations I've talked to have tried some of the new shiny tools out there. A lot have invested in expensive dashboards and portals and spreadsheets, and many have layered technology on already strained clinicians. But what we found out is they just haven't worked. The solutions that have worked, however, were the ones that, one, integrated directly into clinical workflows. Number two, surfaced intelligent at the right moment, and that usually is at the patient member encounter. And also, and most importantly, earned clinicians' trust. Healthcare has finally started to understand that technology itself doesn't fix healthcare, but usable technology does.
Absolutely. And speaking specifically from the health plan side, I think the shift was just as real. There were more audit pressures, and there were tighter regulatory expectations, and documentation accuracy stopped from being important to becoming completely existential. And plan leaders told us, right, that we need documentation that stands up in an audit without burning out our clinicians. So 2025 shifted compliance from event that we prepare for to a continuous state that must be maintained. And emotionally, specifically from a clinician perspective, I think burnout was still there. There's still a lot of complexity, but there was clarity from knowing what is really needed, which is don't give me more tools, but give me help in the workflow. So that has shaped a lot of what we have built at Inferscience, and we've learned and validated from it. So let's move on to talking about, last year's conversation. So looking back, last year, V28, RADV, quality, interoperability, and augmented clinicians. Which themes do you think became most real in 2025?
Wow. Well, there certainly were plenty of issues last year. There wasn't a shortage of those, many of them critical to operations. However, two really stand out. The first one is the urgency for risk adjustment and compliance working together. Health plans urgently tell us that they wanted accuracy, had to have accuracy. They needed defensibility, and they needed to be able to reduce their audit exposure. That's exactly why real-time documentation intelligence resonated. because leaders didn't want to do cleanup later. They wanted confidence right up front in what they were doing. The continued increase in cost in terms of cost, time, and personnel for things like retrospective chart retrieval and coding as a year-end cleanup process, one that many of our providers and plans have just gone through, is expensive and it's rampant with inconsistency and potential errors because it's so rushed. Second of all, when we look at this, we're looking at interoperability, but it really needs to actually matter. Conversation is now shifted from can we just exchange the data to can clinicians actually use this in a meaningful way? They just don't want more volume. They want clarity and they want confidence at the point of care.
Right. And then also from a clinician perspective, augmented clinician concept did not really stay theoretical, right? We saw it happen. Clinicians were supported, but not replaced. Documentation was strengthened, but not burdened. And AI is humanizing care rather than mechanizing it. So that may be one of the most important shifts of all. Let's talk about real world feedback that we got, right? So, Mark, what did we hear consistently from organizations we worked with in 2025?
Well, we heard a lot of things, Sunil, as you know, some of it good, some of it bad, but three words came up repeatedly. One was clarity in processes. One was speed. And the final was probably confidence. Providers said, listen, help me do the right thing faster. Make sure that it's accurate, but don't slow me down. Don't put me bouncing around all over the place trying to find solutions. Health plans on the other side finally started saying, stop siloing quality, coding, compliance, and documentations. You have to help us align them. After years and years of siloing operations between those four, health plans have finally started to realize that from an operational and revenue concern, they really had to put these silos together. And not only did it improve, but it also produced better and more appropriate health care. And I use that as two separate words. It really is care and health. So solutions that connect those dots instead of just fragmenting them are really making the biggest difference.
Yeah, and honestly, nothing is more rewarding than hearing a clinician say that this finally feels like support, not surveillance, not just somebody checking on us. So that is our goal, to help clinicians and plans. So let's look forward. If you had to define the themes that leaders must get right this year, what would those be?
Well, the first one has to be compliance precision. They have to get it right. They have to be audit ready because that concept is not this theoretical anymore. It's a day-to-day mandated must do. So documentation must, first of all, be accurate. Second of all, must be defensible. And third, has to stand up against scrutiny that they've never had to go through before. And our organizations need to have that confidence. And most importantly, they need to be able to have that confidence before the claim goes into the claims process, not having to turn back around and retroactively do it after the encounter. The second thing that we've come across is real-time decision enablement, meaning separate dashboards, while they're pretty, don't provide much, not retrospective analysis or spreadsheets. What the industry needs is intelligence at the moment the care happens. This is what we mean by being able to provide that real time.
Absolutely. And I would add one more, which is a technology that builds trust. So trust between clinicians and the data that is given to them, trust between health plans and providers, and obviously, probably most importantly, trust between patients and the healthcare system. So that's, I think, what will define successful organizations in 2026. So let's talk a little bit about where Inferscience is heading. Since this is our internal episode, so let's talk about what our direction is in 2026. Tell us more.
This is going to be an exciting year for us at Inferscience as well as for healthcare in general, and we are really doubling down on multiple fronts. The first one is to make sure that we are deeply embedded our intelligence inside of the EHR workflow so that this intelligence is available at the point of care, not encapsulated in a portal or a report somewhere else. The other thing is the focus on the clinician-first usability. We've built our reputation on being able to understand and work with clinicians and work within their thought processes, their clinical training, and their workflow. And finally, from the provider standpoint, being able to documentation that is accurate and audit straight. It has to be accurate and it should be validated before it leaves the EHR. The same thing can be said for quality. Quality gaps are very, very similar, except they need smarter enablement. Physicians are saying, show me where the gaps are and what I need to address them at the time of the encounter, not as some secondary process or secondary report. Also, when it comes to providers, we have to reduce the burden while improving precision. Physicians are telling me, make me better, make me more efficient without taking me away from my patient. And if you can you give me back a little time at the end of the day? So we're expanding partnerships with health plans and provider organizations across the country who want real, responsible, proven AI, not just hype.
Absolutely. And I would add that, you mentioned reducing burden. So we are actively working on enhancing our UI, which is already very much designed with clinicians in mind, but just making it even better and more sort of focused on, providing the right recommendations at the right time without a lot of noise to the clinician. So that should be coming out in the next month or so. So hopefully our users will find value in that. Yeah, and from the perspective of this podcast, Care Decoded, we are going to be staying the place for clarity, real conversation, and meaningful guidance, not just buzzwords. And before we close, something that we are excited about, and I want to mention, Inferscience will be presenting at the Risk Adjustment Innovations Forum next week, actually. And we are looking forward to connecting with leaders who want to talk about compliance precision, audit confidence, documentation accuracy, quality performance, and AI that clinicians can actually trust. So if you, the listener, will be there, please reach out. Let's talk about strategy. Let's collaborate. Let's build smarter systems together. And in closing, everyone who joined us last year, a big thank you. And to everyone who is stepping into 2026 with us, we are excited to continue the conversation. Last year proved to be something powerful, or rather it proved something powerful. Healthcare does not need louder technology. It needs smarter, more human technology. And that's exactly what we are committing to building at Inferscience. So thank you for being part of Care Decoded. And here's to clarity, innovation, and better care in 2026. Let's keep decoding care together.